So, you are walking, and you fall, but it wasn't a soft fall because you hit your head hard. A few hours later, you start to notice you're more fatigued, having difficulty concentrating, have a headache, and notice dizziness when moving your head. You head to the ER, and the doctor tells you that you have a concussion. You've heard of it before, but you don't know much about it. So, what exactly is a concussion? A concussion is an injury to the brain due to mechanical forces or trauma, often resulting in short-term losses of normal brain function. There is not necessarily structural brain damage, rather abnormal functions within the brain's networks. Repeated concussions are dangerous as they pose a risk of permanent brain damage that can lead to lasting deficits in function. Chronic traumatic encephalopathy, or CTE, is a progressive and fatal brain disease resulting from repeated injuries to the brain. This condition has commonly been found in football players, boxers, and other athletes with successful careers decades ago. Unfortunately, CTE is diagnosed by brain analysis after death, but there has been a decline in suspected cases with increased knowledge of concussions and safety measures. Although concussions are known to result from sports injuries, they more commonly occur with falls. Adults 65 years and older are at a greater risk of falls and may experience delayed onset of symptoms. Infants and children also risk falls and sustain a concussion from high surfaces. Other cases of concussions include falls from a bicycle or sports accidents, abuse victims, blast injuries, and work-related injuries. How do I know if I have a concussion? The presence of brain damage cannot be identified on an MRI or CT scan, making it more difficult to diagnose. Therefore, concussions are diagnosed based on clinical presentation, that is, based on symptoms and history of the injury. Research continues to hunt for better and accurate diagnostic measures, but for now, it is important to report anything out of the ordinary. That being said, concussion symptoms may include headache, which is the most common symptom, confusion, changes in vision, light sensitivity, dizziness, nausea and vomiting, memory loss, ringing of the ears, difficulty concentrating, slow reactions, and changes in judgment. Symptoms may impact sleep, activities, school or work, exercise, and normal function. Because sleeping is often affected after a concussion, it is important to have good sleep hygiene. This may include a regular sleep schedule, avoiding blue lights at night, only using the bed for sleep, avoiding naps if they interfere with night sleeping, and doing something relaxing outside of the bed if you are unable to fall asleep in the first 15 minutes. Now, you may be thinking, how long does it take to recover from a concussion? Most people recover from concussions in 7 to 10 days, but some people have symptoms lasting longer than this. With that being said, the risk of additional concussions is the highest the first 10 days following a concussion. Therefore, it is important to minimize activities with a greater concussion risk and let your brain heal. Recovery time may take longer if there is a prior history of concussions, which may indicate there is lasting brain damage. An individual with symptoms lasting longer than 3 months is considered to have post-concussion syndrome. These individuals may require additional treatment for symptoms, and there's a possibility that deficits may remain. The recovery timeline and process look different for everyone because no individual with concussions are alike. It is important to seek an appropriate medical care team with concussion knowledge to help speed and direct recovery. A medical care team may include doctors, therapists, and athletic trainers depending on the age and needs of the individual. For athletes, there may be resources to aid recovery set in place by different schools or sports organizations. Although recovery looks different and is individualized, it generally follows a similar progression. It is important to rest for no more than 24 to 72 hours, as prolonged rest may increase the time it takes to recover. During this rest period, it is important to include both physical and cognitive rest. Physical rest refers to harder, more energy-demanding activities. This excludes daily activities such as washing the dishes or grocery shopping. Cognitive rest refers to avoiding activities that require high concentration. This may include school, work, or phone use. After a short period of rest, more physical and cognitive activities should progressively be incorporated into the individual's routine. This may vary depending on the individual and their goals. For an athlete, this may include the progression of light exercise, strength training, sport-specific activities, then return to play. It is important not to progress more demanding activities if symptoms have increased. When concussions are lasting longer than normal or symptoms are not improving, it may be beneficial to get treatment from medical providers such as a physical, occupational, or speech therapist, neuro-ophthalmologist, or neuro-optometrist. Depending on an individual's symptoms, these healthcare providers can address balance, dizziness, cognition, visual changes, and more. Can someone with a concussion work or go to school? Yes, it is important that someone with a concussion continues to perform their daily activities and routine as best as their symptoms allow. Full return to work or school may be challenging at first, therefore accommodations with school and work should be made to aid brain recovery. Accommodations should be individualized based on symptoms and tolerance, but generally they should focus on gradual return to cognitive and typical activities. For a student, accommodations may include more time to perform class activities or homework, note-taking help, low light or low sound environments, frequent breaks, or shorter school days. Similar accommodations can be made for working adults, or there may be options to perform other duties while recovering. For athletes, it is important to determine the correct time they can return to play. This is difficult to determine as symptoms may resolve before the brain is fully healed, but there are various protocols that are often used to help make this decision. Athletes must be symptom-free, require no more accommodations in the classroom, have successfully completed a return-to-play protocol, and have been cleared by a medical professional. Although concussions cannot be eliminated, there are many steps that can be taken to mitigate the risk of concussion. Infants and young children should always be secured safely when in elevated surfaces. They should never be set or left on surfaces such as tables. Bicyclists and individuals in similar recreational activities should always wear a helmet. A helmet cannot prevent a concussion, but they can minimize the severity of the injury. Workers in high-risk environments should report unsafe environments, while employers should work to keep their employees safe. Fall prevention strategies should be a focus for those at an increased risk for falls. Lastly, safety in sports continues to improve with more research and understanding of the condition. For athletes and parents, the risks and benefits should always be discussed when returning a child to a sport, especially contact sport with known higher rates of concussions. The more concussions your child gets, the greater the risk for permanent brain damage, which can affect your child's future on and off the field. Before your child returns to play, evaluate the risks and benefits and discuss the importance of protecting the brain with your child. Finally, if you or someone you know is experiencing any symptoms of a concussion after trauma to the head, seek medical attention as there may be serious injuries involved.